Okay, this kind of sounds bad. I was going to say don't be stressed out, but you're going to be stressed out. I know like no one wants to hear that, but it truly is like very stressful, and you just have to deal with it and go with it. And I know it's really good to have like a support system with you. Freshman year of nursing, like I walked in here, didn't know a soul in the classroom, and now senior year, getting ready to graduate, and I know that like I found the friend group that I'm gonna have for like the rest of my life. And I know that sounds cheesy, but it's true. And having those people that like know my struggles, like they struggle alongside me, they succeed beside me, like no one else is gonna understand like what I mean when I talk about like some crazy patient care like experiences. Community is very important when it comes to managing like my stress levels.
The first thing you want to do is like recognizing yourself, am I stressed? Because we learn to assess in our patients different things. We learn to assess their breathing, their circulation, the ABCs. We learn to assess their skin, their cardiac function, and we learn to assess their stress sometimes as well. So we need to take what we've learned in school and apply it to ourselves.
With nursing school, it can be really overwhelming, and it's easy to kind of get lost and buried underneath the stress that it creates. So the biggest thing that helped me was just staying organized. The biggest way that I stay organized was having a planner and being able to be proactive and write down all the due dates.
Well, honestly, the best thing to do is to not stress yourself out about it, to be confident that you have that allotted time to study, and to also incorporate other activities so you're not constantly thinking about it. So if you're going to study 3 to 4 hours in the morning, then in the afternoon to plan some, mental health things that will get your mind off of it.
Some studying strategies throughout the day would be, don't try to cram everything in at once because it will lead to burnout. Instead of studying like 12 hours a day, study it to 3 or 4 hours a day.
One of the most important things to remember is to get 7 to 8 hours each night. Also, a lot of people like to get on their phone when they're lying in bed before they fall asleep, but this actually stimulates your brain, so try and do something like reading a book or something before you go to bed.
Self-care in nursing is often overlooked, but it's such an important part in nursing because you can't give your patient 100% if you don't put effort into yourself and yourself feeling 100%.